Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about the push to change the diagnostic criteria for Alzheimer's. Currently, there's things like cognitive testing. There is potential for spinal tap to look for those abnormal proteins. There are neuroimaging that can be done. There's also autopsy, which is really what it used to be. It was kind of a diagnosis of exclusion. But there's been some change. So like these whole proteins, these amyloid plaques and neurofibrillary tangles, tau proteins that they accumulate in abnormal amounts in the brain. And I've covered this many times that is what we want. A blockbuster. The drug companies want a blockbuster drug for Alzheimer's so they can make billions upon billions upon billions of dollars for that. The problem is that they've all pretty much failed. The newest one that I've certainly covered before, Leqembi, whatever it would be, runs about $26,000 a year. Not really a whole lot of cognitive improvements on top of things like swelling of the brain, blood and bleeding on the brain. So not good. But they're like, hey, maybe if we gave it to them earlier, so instead of making $26,000 a year for a couple years, gosh, maybe we can start giving it to people a decade before. So make no mistake about it, using blood markers for people who might develop Alzheimer's serves the drug companies and only the drug companies. So the idea is, hey, let's look at some blood values, specifically around like the tau protein, like the phosphorylated tau protein 217, whatever it is. But if we can look in the bloodstream and we can find a marker and we can draw it, you're perfectly healthy, you don't have any symptoms, you probably won't develop them for another decade or so, and even, quite frankly, people who have this elevated tau protein, like the numbers run where if about half of the people who are in their mid-70s have these elevated blood markers will never develop Alzheimer's. So you may or may not develop Alzheimer's, but let's start giving you a drug early because we found something in the bloodstream that now we can justify using this drug or any other drug that costs $26,000 a year for decades instead of 2 or 3 years. So the reality is that Alzheimer's is absolutely a disease of lifestyle. There are some factors that play a role that are genetics, but really it's a type 3 diabetes. Exercise, dietary changes, all of those things play a role. Those aren't going to make drug companies money. So the idea is, hey, can we just shift the goalpost so we can now give more drugs to more people? Whether or not it's going to help, we don't really care. We just want to make more money and call it a day. And so that's where the powers that be, you'll see that in the link in the post in the description, that they're changing the definitions or the criteria for Alzheimer's based on blood markers. So you don't have to have symptoms now. Maybe you might not even develop symptoms, but we're going to label you with Alzheimer's anyway because of this blood protein. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.